JR, what is bibliomania?
I think I'm going to have a better chance at spelling it.
Okay, spell bibliomania.
Hold on, let me get my computer. It's Bibliomania for 500.
Bibliomania for 500.
Bibliomania.
Well, it's the obsessive compulsive need to hoard and collect books. Bibliomania.
Wow. Are you calling me out or something?
I think I might be.
Dysh. Dysh. Dysh.
Hey y'all, it's Onika.
And JR.
And you are dishing with Dainty Dish. How you doing today, JR?
I'm doing fantastic. It's a wonderful evening. Well, when we're recording this, so
Okay.
my day went well. I mean, it was a good day. Yeah,
All
I'm
right.
good. Mentally, I'm stable.
You stable?
I'm stable.
That's good.
How are you?
I'm mentally stable as well. Luckily this week. It's a 50-50 shot with me sometimes whether that's going to be the case, but this week I'm doing well. Our cousin Daniela actually called me. Hi Daniela. Called me this morning and gave me a really special invitation. She wants me to come talk to her some students at her school about the podcast. So I'm doing that in May. I'm really very excited about it.
Oh, congratulations.
Thank you. And another speaking engagement at Humber on April 16th, I think. I'll be talking to some...
I don't know if you want to give the dates out for that because it's not a public...
Oh, it's not a public event. But I'll be speaking in Humber in April as well to a class full of social worker diploma program students.
Oh, okay.
So I'm very excited about those upcoming talks. A little nervous. Not used to it, but you know what? I'm going to just blow through it. Just truck it through.
Sure, okay.
But anyways, wondering, do you know what's been going on in the news?
That was so corny.
I know.
That was like ridiculous.
That was so stupid.
Because last week you just did a whole show on the news.
Yeah.
I don't know. I've probably read a couple things. Actually, there's a couple things. Randomly, hip hop star Big Sean opens up about his struggles with mental health and therapy, and seeing how he wasn't in a good place. That's like, and now he is in a good place, comparing himself to last year.
Okay.
Just saw that. A friend of mine pointed that out on Instagram.
Ooh.
Yeah.
Good luck, Big Sean.
Yeah. Also, there was in the paper today that I was reading. So Ontario school guidance counselors are seeking more resources for mental health. So because of their concerns, right? So something we talked about before, and I was like, meh. But actually, there was a survey that was done amongst the teachers in Ontario, I believe, actually confirmed.
Mm-hmm.
And overall, I mean, the results said that they would like to have some more resources and have more training to deal with mental health because of what's going on with the students. So they see a need and they're all about it. But the one thing that really stood out to me this week was that I guess the Ottawa Public Health Department has decided to release some new videos for newcomers about mental health.
I read this.
Did you read about it? Okay,
Yeah.
so I actually watched the video. The really cool thing about the video was the guy has a thick immigrant accent who's reading it, and I thought that was amazing.
That's good. That makes sense.
He has like a thick, like non-Canadian, American, British, like Western accent. Like English was definitely his second language, but it's really cool. Like it made me remember. It reminds me of all the people that I work with because like they give some stats in the video. Like I think it's like only 20% of the people are actually born in Canada now. I think it's like 80% are immigrants.
Immigrants?
I
Okay.
might have that wrong. That stat wrong. But one of the cool things is they gave a lot of information in the video. Like you can dial 211 for programs and services for new Canadians in your community. They also like brought up the idea that, you can try and, get to know people by, like creating activities, and you should make a list of things like maybe like having dinner or helping your neighbor shovel the snow. And they also gave some more resources as well that you can look at as an immigrant or as a newcomer to the country for mental health. Settlement.org was one. havethattalk.ca was another one.
Okay.
And multiculturalmentalhealth.ca was the fourth one.
Ooh.
So, I mean, there's a lot of resources out there for newcomers that are coming to Canada and for them to discuss, some of the challenges that you might face with your mental health. One of the things I'm assuming is, our long, cold winters. If you're coming from a cold country.
Yeah, warm climate.
Because most immigrants come from, like our families all came from warm climates, right?
Yeah.
To come up here to the north.
Caribbean.
So, I mean, you definitely want to be able to adapt, and that's probably something that you got to deal with, like, mentally. It's probably like a real strain when you first come here. I don't know. I never had that effect. Did you? I was born here.
I would say if I had to look at my younger self coming to Canada when I was 5, I had some PTSD between the cold of the country and experiencing racism in kindergarten, like kids not wanting to play with me.
Okay, we're not going to go to that. That's not what I talked about. That's not what I was
what
asking.
I'm saying is, like, as a newcomer, I would have liked to have resources to help me, like, guide my way through becoming a new Canadian citizen.
Anyway, moving on. What do you have to say today?
Jesus. Our transition, we got to work on our transitional sentences, I think.
Oh,
today.
no, it's a matter of, like, you just said something that kind of just, like, put me off, and I'm like, all right, you know what? I have nothing more to say. What are we talking about today? What do you have me here for? Why am I here?
Why are you here?
Why am I here?
Well, I was looking for a topic this week and I actually fell down the mental health rabbit hole. And I realized that there's a lot of, like, big sexy disorders we talk about. I'm calling them the big sexies because they're the ones we most commonly hear about. Depression, anxiety, bipolar, schizophrenia. But there's a lot of other disorders out there that we don't often hear about. And I did a little reading up on those disorders, and I want to share that with you today.
Oh, okay.
So, speaking of falling down the rabbit hole, let's start with Alice-in-Wonderland Syndrome. Ever heard of it?
No.
Well, it's a neuropsychological condition. And it affects...
Can you just give me plain English?
Okay, it affects your perception and your environment. So basically, think of the book Alice in Wonderland. That's what it's been coined after. When Alice drinks the drink and she becomes bigger than the room that she's in. So people experience that feeling often, as well as things being too far away or too close to them.
Your depth perception and stuff?
Your depth perception is completely off. It's very common in children. They have, like, problems just that, like, nighttime sleeping. It happens usually a lot before sleep time. But it's an interesting. I thought it was a really interesting disorder. I'd never heard of it. I read up this woman named Abigail Moss, lives in the UK. She's experienced it as an adult, actually, and she continues to experience it. She says it can happen when she's working or right before bed or, when she's doing general activities.
And then she just automatically feels that...
Like, her hands feel bigger, the room starts to shrink, she gets really disoriented. It could be onset by, like, headaches. Migraines are a common result of this disease. Some people say it's brought on by migraines.
So it's like it's a result of a migraine?
It's almost like it's a result of a migraine. The migraines are a big part of it, but you get, like, size disorientation, perception disorientation, even time disorientation. Like, you don't even know what time it is.
Oh, okay. Well, I mean, if I don't have a watch, I don't know what time it is.
If you don't have a watch.
And you expect a kid to be able to tell time? That's
true. But it does affect time, size, and perceptual disorientation. That's what it mostly affects. And they suspect that Lewis Carroll himself suffered from the disorder.
Oh, that's so cool. That is so cool. Like, that's... Like, I don't... Like, it's cool because, like, he was able to capture it in the novel.
Exactly.
That's... Well, I guess the best writing comes from experience something, right?
Mm-hmm.
Wow. Oh, okay. What else you got for me?
Okay. This one is near and dear to my heart, the Autism Spectrum Disorder. Now, a lot of people kind of, I feel, when it comes to mental health illnesses, separate autism and the autism spectrum from mental health, but it is actually a mental health condition. It's in the DSM-5, which is the Diagnostic Statistical Manual. We've quoted that one before. It's in there as a mental health disorder, and it's a developmental disorder where people have trouble socializing, interacting socially, as well as communicating. They have also restricted and repetitive behaviors as well. And this makes me think of my cousin Patrice, our cousin Patrice. Yeah. She's had autism our whole lives. She is now 30 years old, living with autism. She's 30. She's
way.
30. She turned 30 in January.
Oh, wow.
And she's living with autism, and she's doing such an amazing job at it. She's like the gem of our family. But I remember the struggles she used to have when she was a kid.
She is like the greatest judge of character that I've ever met.
Yeah. If Patrice doesn't like you,
you've got bad vibes.
You got bad vibes. You got bad eye. You got bad eye.
No, she's real. No, like I'm not. That's not even a joke. That's like she's a really good judge of character.
Mm-hmm. But what is so interesting that I'd read about the autism spectrum disorder was that 1/3 of people that have autism go through anxiety. So either social phobias, separation anxiety, or excessive worry. And I always wondered when Patrice was younger if she might have experienced any of those things, because there was a period of time where there was a lot of just general temper tantrums because developmentally, she wasn't always there. And but there were other times where I would see the excessive worry in her. Like I would see it. I would physically see it. Like when she was worried about the way her room had to be, or the type of music she listened to, or the perfectionism with her piano playing. Like it was very clear she would worry.
Mm-hmm. Okay. I don't know. And
I also wonder if she ever, because they also say that people with autism in their young adult and teen lives, young adulthood and teen lives, go through depression, but because they're unable to communicate how they feel, it often goes untreated or unsought, like no one sees it.
Okay. Well, I mean, no one sees it, or no one's able to identify or understand it.
Yeah, maybe identify and understand it.
Yeah. But like there's different from my little limited knowledge. There's a whole spectrum, and you can be anywhere on the spectrum. And because I know I've met people that have autism, and they're like fully productive. It's like if they didn't tell you, you wouldn't know.
That's why it's called that's why I was going to say it's called spectrum, because some people have cognitive limitations and some people just don't have the same cognitive limitations of autism that others do. Mm-hmm. So another example of that I was going to go into is Asperger's syndrome. Now, that's not necessarily classified as a developmental disorder so much as it is a difficulty in social interaction and nonverbal communication. Isn't
Asperger's the one where people just like swear all the time?
No, that's Tourette's.
It's Tourette's. Oh, okay.
That's Tourette's.
Okay.
So Asperger's, my grandma Judy's grandson has Asperger's. He was also diagnosed with schizophrenia, because there's a connection between schizophrenia and Asperger's.
Okay.
They're still doing the research on it, but a lot of people who are diagnosed with schizophrenia later on in life are also diagnosed with Asperger's, and vice versa.
Okay.
Because the symptoms are similar, not the hallucination part, but the ability to socialize, interact with people, the nonverbal communication stuff. So it's those cognitive symptoms that that present themselves as either schizophrenia or Asperger's.
So with Asperger's, is this one of those situations? It's the disorder where you are aware of your feelings, mm-hmm. but you're unaware of what another person's feelings. Like you said social cues, you can't pick up on those. Is that what?
Yeah.
Okay.
Yeah. And just again with the DSM-5, because some of those ones that we're talking about are going to be in that diagnostic manual, and some of them are not, but people do consider them mental health disorders. And with this one, apparently in 1994, it was separated from autism spectrum disorder because it didn't have the same language impairment or cognitive impairment that the autism spectrum disorders have. But in 2013, when they updated it, they actually included it, Asperger's under autism. So it's Asperger's autism disorder now, syndrome.
So is it like a linear? Oh my gosh, I don't know how to say this. Is it one line and at one end is Asperger's and at the other end is autism? Is that like how they're?
I can't really say. I'd have to really look into that. But like, the problem is you can't really, and this is what I read when I was doing my reading. You can't really compare autism with Asperger's because, like I said, autism has it's more, the cognitive limitations are more there than they are with Asperger's.
So is it at the center point of this line? Is that where you're going to start seeing cognitive challenges as opposed to, I guess, social cues?
I don't know if it's at the center point. I think one, it's going to have to be at one end and one's going to have to be at the other.
Yeah, but at some point there's a midpoint.
There's a midpoint.
Like I'd be interested to find out. Well, we have to get someone on here because I'd be interested to know what the midpoint is. Then, on that scale, just for an understanding purposes. Because if they're two, is it diseases or is it like, what do you call it? It's a
disorder. One's a disorder and one's a syndrome.
Whoa. Okay, disorder versus syndrome. Okay, so I do not know the definition of a disorder versus a syndrome right now.
Google it.
I feel like we should just pause this episode as I look it up, or you can just talk while I look it up.
Yeah, but what was I going to say? Famous people that have Asperger's syndrome. Stanley Kubrick, director.
I don't know who that is.
He's a director. Well, a couple of these people have passed away. Michelangelo.
The painter?
The painter. Apparently,
okay.
Because what happens is they focus on certain interests. That's another thing that people with Asperger's do. They get very good at certain things because they focus in on certain interests.
Oh, okay. Well, is that the same with autism? Because I know our cousin, she's like, when it comes to music, music and cooking, she's like, those are things that she focuses on, and she's really good at both of them. So is that kind of something similar?
Yeah, so that's the similarity between the Autism Spectrum Disorder and the Asperger syndrome. So it's that restrictive and repetitive patterns of behavior that the two of them share.
Okay.
But Dan Aykroyd, Ghostbusters. You know Ghostbusters? Dan Aykroyd, Canadian. Is he still alive? I don't think he is.
Don't.
I shouldn't start rumors. I shouldn't start rumors unless I know. So Dan Aykroyd,
ridiculous. He is well alive. Do not start rumors.
And Robin Williams, who we all know, passed away. Robin Williams, he used his Asperger's to his advantage and made a very thriving career out of his comedy and his comedic sense of timing.
Can't believe you just said, Dan Aykroyd.
Sorry, Dan Aykroyd.
Shout out to my second CD brother, Dan Aykroyd.
Sorry, Dan Aykroyd.
I can't believe you.
I'm so sorry,
Shout
Dan
out to my second
Aykroyd.
CD brother. Oh my gosh.
I'm so sorry.
Okay, so back to disorder.
Disorder and syndrome.
Because the word disorder is in the definition of syndrome.
So syndrome is the chicken and the egg. Syndrome came first.
I don't know, because it says, okay, here's the we're gonna hear my reading skills. Oh my goodness.
Awesome.
This is gonna be great. A syndrome is a group of signs and symptoms that occur together and characterize a particular abnormality or condition. Okay, that's a syndrome.
That's a syndrome.
Okay, well, I got a better definition now, so I gotta roll with it. A disorder is a state of confusion, not really. Medical disorder, we should probably look that up.
So let's look up medical disorder. Which I think encephalitis lethargica is one of them. We'll get into that in a minute, though.
Oh, here we go. I got one. What's the difference? Here's the difference. Okay, disease, disorder, condition, and syndrome. I found it. Okay.
Oh yes, here we go.
Here we go.
Because we need to know this if we're going to share our knowledge.
Yeah, we got to do
this. We got to know this stuff.
No, I'm stating my limited knowledge. We're
limited, but we're doing our best.
Let me start this again. Okay, so what is a disease? Resulting from pathophysiological response or external or internal factors. Okay. What is a dysfunctional disorder? A disruption of the disease to the normal or regular functions in the body or part of the body.
Okay.
Syndrome. A collection or set of signs and symptoms that characterize or suggest a particular disease.
Okay.
And then a condition is an abnormal state of health that interferes with the usual activities of or feeling of well-being. I get all of them except for disease, to tell you the truth.
All are good, but disease?
Well, I don't know what pathophysiological means.
Pathophysiological?
I don't know what that means.
I don't either.
Well, I'm going to find out, because when you don't know things... You know, remember when you're a kid, and look, I used to hate this. When I didn't know what a word meant, like, my parents would tell me to look it up in the dictionary, but it's like, if I don't know the word, I don't know how to spell it, how can I find it? How can I find it in the dictionary?
So you go on a dictionary adventure.
But you always find it.
You always find it.
And then you feel really, like, dumb.
And you're like, oh, there it is. There's that word. But just, sorry, going back to the autism spectrum, some of the people who are on that spectrum are Susan Boyle. Remember that singer that won, like, UK Idol? That opera singer? Susan Boyle? You remember her?
Maybe.
White
It
lady?
sounds... Why? You said Susan.
Susan.
And Boyle.
I didn't say Shaquana.
I just made an assumption there. But,
and
okay.
Charles Darwin, Bill Gates, and Steve Jobs. All on the spectrum.
Oh, that makes sense.
Geniuses by their own right. I mean, Charles Darwin.
Well, I mean, no,
Darwinism,
he's
an ism, for heaven's sakes.
Steve Jobs was an asshole. Like, I've read some works on him. He's an asshole. Like, he had no regard for anybody's feelings except for his IT passions. So, I mean, that makes sense.
That makes sense. Oh, you know who else is? I just watched the comedy special Amy Schumer's Growing on Netflix.
Not
and
a fan.
her husband, I know, but her husband has Asperger's.
Oh, okay.
And she says that it's so refreshing being with someone who can't lie. Like, they're honest all the time. He's a chef, apparently. He's gorgeous, by the way. But he's a chef, and he's on the spectrum, and he can't lie. He just tells her, like, she was giving this joke about, like, oh, do I look good in this outfit? He's like, you have a lot of other outfits in your closet. Maybe try one of those ones on. Like, just dry.
Wow.
Like, dryness.
Wow. That's amazing. See, I would love to get away with that.
But my friend and little brother Travis is just like that, too. He tells it like it is. He always has. There's no filter.
Oh, was this for which this was for
Asperger's.
Asperger's? Okay. Do people with autism tell the truth too?
Mm-hmm.
Because I know my experience, because I don't know if people don't know, but I have vitiligo, and it happened after I was 30. So our cousin Patrice, who hadn't seen me in probably like 2 years, the first time she saw me, it was like, who's this guy? What happened to your face? And I was like,
they have no filter.
Honestly, it was refreshing, because at least someone said it.
Patrice told me the other day, Onika, you're getting fat. Like, why are you so... Mom, look at her. She's so fat. Like, why are you so fat? Like, just bull face, like, just reality check in the face. Like, it was awesome. I'm like, nobody other than my mom who tells me I'm getting fat. Patrice is the only one who just came out with it. You're fat.
That was pretty... Like, I enjoy that. It's
refreshing.
Yeah.
It's refreshing. It's refreshing. But moving on.
Yeah, let's move on.
Moving on. Encephalitis lethargica.
Encephalitis, isn't that like an STD?
No, that's syphilis. Why don't you know your diseases right now?
Because I'm a pretty healthy person. I try not to get sick, so I don't really have a reason to know this stuff.
This is the sleep sickness. So the disease gets into your brain. It's a disease. It's not and this is what's interesting about this one. This one's contagious. It's a mental health disease. Oh, that's what disease means.
Diseases are contagious.
Diseases are contagious.
No, because cancer is a disease.
Cancer is a condition.
Oh. Hey, I don't know.
Cancer's a condition.
Okay, we're gonna roll with this. Diseases you can catch. STDs.
STDs.
Well, they're infections now.
Those are infections, but they're diseases. They're diseases.
Okay. Anyway, keep going.
I don't know why I'm laughing so hard. Encephalitis lethargica.
Okay.
So it's a sleep sickness, and the disorder is basically characterized by, like, you end up in it infects your brain, and you end up in a statue-like condition where you're motionless and you're speechless.
Oh, wow. That's got to be terrible.
So it's preceded by double vision, high fever, headaches, and your physical and mental response are delayed. So there was actually an EL epidemic between 1917 and 1928. So this is my fun history fact. So during World War I, when everyone was like going across Europe, the epidemic of EL started in Vienna. And then it got up to worldwide epidemic proportions by 1919. And it had spread across Europe, the United States, Canada, Central America, and India. And get this fun fact, guys. Adolf Hitler is said to have had EL in his younger years, in his young adulthood.
So you can get over the disease.
You can get over. That's why it's not narcolepsy, which we'll get to. But EL, you can get over the disease. But it's like a sleep disease that just spread across the world during World War I. A million people.
But do you actually like wait? Stop. But do you wake up eventually? Like, how do you resolve it? Do you know like the antidote? Do you know the treatment?
Honestly, sometimes there's no way to resolve it. You just have to let people go through lethargy, and in certain cases, people end up in a coma.
Wow.
That's also what distinguishes it from narcolepsy.
Okay, I feel like I'm like House MD. What's the differential right now?
Yeah,
we're trying to figure it out.
It's crazy. And Adolf Hitler had this. He was sleeping on the job. Like, I'm not touching it. I'm not touching it.
Yo, the plank's right over there. I'm gonna go have a coffee, and I don't drink coffee.
Oh my gosh. Yeah, so now the difference between that and narcolepsy, that's a long-term neurological disorder that affects your sleep-wake cycle.
Yeah, I met a gentleman when I was in New York the second last time I was there. I was in a bar with, I met him and his wife. They were watching football, and we ended up chatting because the vitiligo again, it's a conversation starter.
It's a conversation starter.
So yeah, but then he ended up saying that he had narcolepsy, which was like, I was like, whoa. So you just fall asleep places? And he was like, pretty much, like that was, it's pretty interesting.
It's excessive sleepiness like during the day, and you fall asleep during any activity.
Unlike the guy that I was in an office beside who used to fall asleep every day at 1:00. Just take a nap. This guy would just nod off, just like 1:00 every day. Just sit at his desk, nod off, and I just look at him like, I'm not gonna wake you. Like, unless someone came around, then I would like bang on the table or something so that he would wake up. But otherwise, I'm like, bro, you do your thing. You sleep.
And last little thing about narcolepsy, it's also has this factor called cataplexy. This other syndrome within the syndrome, and that's when you're awake, but you've experienced such weakness that your limbs, like, you can't move. Your limbs go numb, and you can't move.
It's like that first 0.5 seconds when you wake up in the morning, but extended for a duration of time.
Basically. So
that's sleep. Like, yeah, sleeping disease. That's tough. Like, I don't know.
I don't know if I could do narcolepsy, like the sleep-wake cycle.
It's treatable, though. I mean, because
the
gentleman I met, he said it was under control. It was treated.
Was he on medications?
We didn't go. I believe so, but I mean, we didn't go into that type of detail.
Okay.
That's kind of personal stuff.
That's true.
Yeah.
That's true. Some of the famous people in the world that have had narcolepsy: Thomas Edison, Harriet Tubman, not to be confused with Rosa Parks.
Oh man, if you've
that's
listened,
a last year reference.
That is like
you have to be an old head to get that one.
Yep.
You got to really be tuning in. Winston Churchill, he used to take naps in the daytime. He's like, his day was not complete without naps.
I mean,
and that guy ruled a nation. Like, he was amazing.
Okay.
And then Jimmy Kimmel.
Jimmy Kimmel. That name sounds so familiar.
He's the Tonight. I don't know which. There's so many Tonight shows. There's so many shows on at night. He's on one of those nightly shows.
He's one of those cisgender.
Jimmy Kimmel Live.
He's one of those cisgender males that has a late night talk show.
Yes.
Okay.
Basically. So next one up, fugue state. Have you ever heard of this?
Say that again.
Fugue state.
No.
So fugue is a Greek word for flight. So it's actually a dissociative disorder that is Look it up.
No, I'm not looking. What did you keep going for it?
You experience a disconnection and lack of continuity between your thoughts, memories, surroundings, and actions and identity.
So you're on a really good acid trip.
Yeah, like you basically get reversible amnesia. So you remember who you are sometimes and sometimes you don't. And whilst you're in this state, like you forget your personality. You forget who you are. You forget all the character traits that make you. And while you're in this state, the reason it's called fugue is because some people will take flight. They will actually go on trips to the beach and they'll wake up at the beach and not know how they got to the beach. Like they'll come out of the fugue state on a beach.
For some reason, I feel that's been like the premise of a bunch of like sitcom episodes or movies or something.
You know what movie I looked up because I thought, you know what, that guy seemed like he was in a fugue state. Memento. Do you remember the movie Memento?
No clue about movies.
Oh my gosh, this guy is so someone murdered his wife, but he lost his short-term memory, so he had to he tattooed his whole body with clues on as to where who murdered his wife. And if you play, actually, the most interesting part about the movie is if you play it backwards, it tells a different story.
Really?
Yeah, if you play, it's like one of those old time records. Like if you play it in reverse, it tells a different story.
In English?
Is it in English? I can't remember. There's two versions of it. The forward version and the backward version.
Okay.
So it tells the two tales forward and backwards. I don't know if he was in a fugue state, but I know a fugue state, it really has to do with dissociative identity disorder. Mm-hmm. It's a result of that. So if you have dissociative identity disorder, you could end up in a fugue state. And it's also, sometimes people think that it's sleepwalking.
Oh.
Because it has all the symptoms of sleepwalking, but it could last a few hours, a few weeks, a few months. It all depends. And sometimes people even will go as far as changing their identity because they don't remember who they are. They don't remember where they live. They don't remember their family. They have no memories. They have memory loss. They can't remember their past. They don't know their future. They don't know anything about themselves. So they'll create a new identity.
Do you go back and forth to so you have your base?
Yeah.
Now can you
your baseline?
Your baseline, but the new identity that you created, can you get back to that eventually?
Actually, that's a really good question. I don't know the answer to that one, but I know that you have your baseline and you can go back to your original self. But I don't know if every time you have a fugue state, you create a new self.
Because that'd be pretty interesting. Because you could have a wife as a guy, you could have a wife and a kids in your regular life, and then you could have a wife and another kids and another in
another part of the world.
Yeah.
Interesting facts. Roseanne Barr. I don't know if she's ever gone through fugue state. I'm not saying she has, but she has identified with dissociative identity disorder, and she's a wacky character. She's
probably one of the funniest female comedians
she's
ever.
Hilarious. She's hilarious.
Joan Rivers, her. I can't think of anybody else off the top of my head.
Yeah, but she's hilarious. And have you ever heard of Herschel Walker? He used to play for the Eagles and the Cowboys.
Yeah.
He says he doesn't remember winning the Heisman Trophy. He was in a fugue state. Doesn't remember winning it.
Doesn't remember playing the whole season?
Playing the season, winning the game, doesn't remember any of it.
So he went through a full season of football. So September, October, November, December, January, February, March.
He doesn't remember specifically winning the Heisman Trophy. I don't think he doesn't remember all of the months. He doesn't remember winning the trophy. He was in a fugue state.
Because the Heisman goes out before the draft?
Doesn't remember it.
Or no, it goes out December, January, around Super Bowl time. I don't know, whatever. You think?
Yeah. Doesn't remember winning though.
Oh wow,
it's crazy. I can't imagine. That's my memories. I have a very sharp memory. I couldn't imagine not remembering things. That would be.
That'd be very challenging. There's a stage in my life that I don't remember.
I remember everything.
It just blend. It's all mush. It's all blended together. I can't my whole marriage. I can't think of
an instant.
I can tell you a bunch of things that happened, unless I looked at my diary or something. Mm-hmm. I couldn't tell you when. It's just a blah.
A mush.
A mush.
A mush.
Actually, that whole 5-year period, actually, the marriage, before the marriage,
So, bleh. Obviously you didn't have obsessive love disorder.
Wow.
You like that transition? Boom!
Like that.
Obsessive love disorder.
Obsessive love.
Oh yeah.
Did not. Is that a syndrome for real though?
It's a disorder. It is not in the DSM-5, but it is considered a disorder. A lot of stalkers apparently have it. So it's a person's feeling of overwhelming obsessive desire to possess and protect another person towards whom they have strong attraction to, with an inability to accept failure or rejection. Now, when I read this definition,
is that like a mother and a child?
Can mothers have obsessive love? My mother's not obsessively in love with me. Like, my mother doesn't have obsessive love over me.
I don't even think she likes you.
I barely think she likes me half the time. She doesn't answer my phone calls most of the time, so I don't think she has obsessive love disorder over me. But it could possibly.
She's got a new desire, a new love of her life.
My niece, my baby niece. It's linked to attachment disorder, borderline personality disorder, delusional disorder, and OCD.
I think obsessive love is just all those things.
It's all those things mixed into one.
Directed at one person.
Directed at one person. All that energy.
Oof. No, I definitely don't have that.
That's some scary stuff.
I mean, how do you react? Like, I don't know. Like, if someone was obsessed with you, like, I don't know how you. Like, I don't know how. I might enjoy it for a little while.
Here's the thing. You know what? And you know why you think that? Movies.
Yeah, that's true.
Movies.
That's true.
Movies make obsessive love seem like the bee's knees, okay?
That's true,
the bee's knees.
That's
like, it's
so
the best
true.
thing that's ever happened since sliced bread. Someone's obsessively in love with you. There's this show on Netflix called You, where the guy is basically stalking this girl named Beck, and he is upset. Like, he's on her Instagram. He follows her home. He's, like, completely obsessed with her, wants to protect her from the boyfriend she currently has. Locks her in a building. Like, just went nuts over this girl to the point where, I'm going to, spoiler alert, he eventually killed her. So, he eventually killed her. I'm not saying obsessive love could lead to that, but I'm not saying it can't lead to that.
I guess I'm not watching that movie.
It's a series, so he's going to have a whole new obsession next season.
Wait, really?
Yeah,
there's like Dexter.
There's like Dexter. He's gonna have a whole new obsession next season. I'm very excited for season 2 of that show. But they romanticize it. They romanticize obsessive love disorder. Like, it could be.
I guess all TV shows do that in some regard, because you got to keep it interesting.
Because what happens after the credits roll? You don't know what that guy's doing to that girl or that girl's doing to that guy after the credits roll, and they're so obsessed with them.
They're characters, so nothing's happening.
No. Something could be happening.
Oh my goodness.
Sequel.
Part 2.
Sequel. Part 2. So this is the one that freaks me out the absolute most.
Okay.
Pterodyne dyskinesia. Pterodyne dyskinesia.
Can you use that in a sentence, please? I'm joking.
Side effects of antipsychotic medications is called pterodyne dyskinesia.
Okay, so you're concerned.
I'm
so you're
concerned
about that.
because I take antipsychotic medications every single day for the last since I was 24. I mean, I've missed a couple of days, but mostly I've taken them, and this is caused by taking antipsychotic medication, and it presents itself with jerking movements of the body, uncontrollable movement of the body. So sticking out your tongue, smacking your lips, chewing incessantly, blinking incessantly, which I'm kind of doing right now because I'm thinking about it. Snapping your fingers, clapping your hands, like things that just generally you can't control your body.
So like just repetitive movements?
Repetitive movements.
Okay. And the annoying ones, though, to other people.
The annoying ones to other people, basically, is what this does. So not only do you have a mental health condition, now you're also annoying.
I think you checked off both boxes already.
I'm already there. I already have it.
Yeah.
The only medication that was on the list of drugs that I have taken is Halidol. They usually give me Halidol to bring me down when I'm in the hospital. So I have taken Halidol, but I haven't taken any of the other ones. So I don't know if I have cause for concern quite yet.
But I guess the doctors know that when they're prescribing that type of medication, because you probably see the doctor on a regular basis, right?
Yeah.
Like how often do you go?
I see my doctor once every 3 weeks.
I'm going for the first time in like 2 years next week. So
oh
I mean,
my
that's
gosh.
like, okay.
Yeah, I see my psychiatrist, but not my doctor.
Actually,
my
no, first time in a year.
psychiatrist.
I saw him last year.
Once every 3 weeks, once every month at least. And he runs the blood tests and does all that stuff.
So I guess they can try to determine whether the drug is no longer working or as effective?
Yeah, they have, because every medication, basically, when it comes to antipsychotics, has the, like, I don't want to call it, it's not like atypical and typical. It's like, there's a word for it. I can't figure it out right now.
There's side effects?
Not the side effects. It's like, this drug was once Halidol, but now it's called this because they've upgraded it. Do you know what I mean? Like, it's an upgrade of the drug. So the older version of the drugs are the ones that cause the pterygium dyskinesia.
Okay, so they've manipulated the formula.
They manipulated the formula, so the newer ones don't necessarily cause the disorder.
Or they're not aware of it yet because people haven't used them long enough.
Long enough, exactly. Whereas the other ones, they would have used for like quite a period of time, and they've gotten old. You know, they've got... Everyone I saw, because I saw a video, and it was really sad. I saw a video with just like some people who had the disorder, and a lot of them were older people. They were like in their 40s, 50s, 60s, so they've been taking antipsychotics since, you know, they were much younger. Mm-hmm. So, you know, I might not potentially see something like this present itself in me until my 40s or my 50s, if it's going to present at all.
And once this presents, what's the treatment? Like, did you find anything else about that?
No, you kind of just have to, like,
switch.
They'll lower the dose. They can lower the doses of your medication. They could switch medications, but you have to monitor it really carefully to see if it's like coming, basically. But once it's here, it's there.
And
but
you're just gonna snap forever?
You're gonna have the uncontrollable movements because there's no guarantee coming off the medication will stop the uncontrollable movements. Right?
So the medication induces this
disorder.
This disorder.
Yeah.
So it's a side effect of the disorder, and it takes maybe X amount of years before it presents itself. Oh, yeah. Wow.
Yeah, so it's crazy.
So do we have a concern now? Because I know, like, I feel like everybody I've met is on an antipsychotic drug right now. Or I would say not everyone, but I mean, like, 1 out of 5, maybe. One out of 8.
For some pretty fucking twitchy people in about 20 years. Mm-hmm. It's crazy because they don't know what they're giving us. Like, they don't. People who are on, and I'm just going to say this now because we're talking about these diseases and the drugs that are involved in them and like what people do to take care of themselves. Like, they don't know what they're giving us. I could tell you this one thing though. Every illness I looked up, every disorder, every syndrome, unknown cause. Doesn't know where it comes from. So if you don't know the cause, how are you supposed to figure out what the cure is? Because
you're treating the symptoms, you're not treating the disease.
You're not just treating the disease. So once you treat the symptoms, then there's the side effects come. Mm-hmm. So it's kind of like they don't really know if this is going to end up happening to me or another person. Sometimes it comes within 3 months of taking a medication, but it could be longer. The medication is accumulating in your system, basically, just waiting to blow up like a bomb. And this bomb could be, TB.
I think that was well put.
Okay. Okay. This one. Okay, JR says, if I can't say it, I can't talk about it. So, give me 1 second. Trichotillomania, also known as TRESH, is when someone can't resist the urge to pull out their own hair. And they pull out hair from all sorts of places, like their eyebrows.
I was going to say, could it be just like a woman just plucking her eyebrows?
Do you know women who overpluck? They could have it. Like thin eyebrows, or people who pick. If you've ever seen someone pick at their hair or pick at their eyebrows.
I cherish my hair. Like, you have no idea. Like, I don't want to pick at it. I'm like, my dad has a full head of hair and he's in his 70s. My mom has her hair and she's in her 70s. Hopefully, I have my hair and keep it.
And funny thing, it occurs more frequently in females.
Does it?
Yes, more frequently in females.
Because is it based off of like an obsession of touching your hair first and then it leads to pulling, or is this something that like, is this like a neurological disorder?
No, it's with anxiety and OCD. It's an obsessive compulsive disorder.
So you start by touching your hair, and then all of a sudden one day you pull it out, and then you keep pulling it out, keep pulling. Okay.
So it's an obsessive compulsive disorder. It's on that spectrum.
Okay.
There's a couple of diseases on that spectrum. It can affect development, self-esteem, body image, sexuality, and relationships. So some people, surprisingly, who have this disorder, Megan Fox.
Who's Megan Fox?
Transformers.
Oh, okay.
Hot girl. I think she's hot at least. Charlize Theron.
No clue.
And Justin Timberlake. JT.
Oh, yeah.
JT has it. JT has it.
He pulls out his hair?
He pulls out his hair.
Whoa.
Yeah, so...
Do you just... Are you just making up stories, or are these, these facts?
These are facts.
It's just because the internet said so? Because I don't want to spread rumors.
The internet said so. No, I looked it up.
I don't want to spread rumors, so...
I looked it up. We have a couple more to go, but this one... Let's see if you can guess what this one is. Dermatillomania.
Something to do with skin.
Yes, you are correct, sir. It's on the OCD spectrum as well. It's the incessant picking of your skin. So it usually starts as a result of having a rash or some type of infection on your skin or some type of condition.
I still love popping my pimples.
I think, honestly, it's also called excoriation disorder. That's the new name for it. But skin picking disorder is what people nicknamed it. And I think, this is true story, I think I had
moving on to
like
the next
this.
one.
No,
Let's move on to the next one. We're not self-diagnosing here. Let's keep up moving.
I used to pick at my feet. It was a gross habit. Let's see. Just some notable mentions. We talked about bibliomania. Telephobia. Do you know what that one is?
You're afraid of watching TV.
No. Perfectionism. Delirium tremens.
I have no idea what that. I don't even know if you said one word or three.
Delirium tremens is a rapid onset of confusion usually caused by withdrawal from alcohol. So you could get that one. If you're not careful, if you drink too much.
I haven't had alcohol in 2 months. No, a month.
And the last one, Ick-Bomb syndrome. It's a condition where people believe they are infested by parasites, bugs, and insects.
Well, with that...
that has been the medical dish of the day.
By non-doctors.
By non-doctors.
Non-medical professionals.
Non-medical professionals.
Do not use anything Googled that we said to diagnose yourself. We were just trying to have a conversation.
Just a conversation. JR, if you guys want to tell us about your strange diseases or disorders or anything you think you might have that you want to share with us, JR, tell them how they can reach us.
Yeah, definitely. You can reach us at Dysh, DYSH, at daintydish.com. Also, if you have one of these disorders and you want to come on the show and talk to us about it,
yes,
hit us up. Absolutely hit us up. But yeah, thank you so much for listening this week. If you're listening to us on Apple Podcasts,
give us 5, which is number 5.
If you're listening to us on SoundCloud, Google Podcasts, all that stuff, thank you so much. We truly appreciate it. If you're listening to us on YouTube, thank you so much. We truly appreciate it. Give us a like, some feedback. We truly enjoy the feedback. We appreciate everybody that's been listening.
So much.
Thank you so much for, I guess, letting us know that this is actually worthwhile and worth doing. Yeah, thank you so much to everyone who's listening. We truly appreciate you. And that is it for me.
As I said, that has been the dish of the day. I hope y'all have yourselves a very, very, very happy day.